It doesn't matter how much you know as a doctor. It just matters how much you understand your patient. So I was talking to someone the other day, they weren't my patient, but they were talking to me about how they were lying to their doctor about taking eye drops for glaucoma, but how they didn't tell their doctor because they never quite felt comfortable sharing it with their doctor, even though they literally were going to that optometrist to get their glaucoma treated. But he felt more comfortable just talking to me in a friend situation than he was talking to his doctor in a doctor situation. And I just think that so many times as providers, as healthcare providers, we understand the diseases so much and we understand the treatment of the diseases so much, but we need to shift some of that attention to understanding the patients. Because if our conversations in our exam rooms aren't real, our patient's not going to follow the treatment plan or understand why they should, and then their life's not going to improve. Our job as doctors is not just to diagnose, it's to treat. And so the more we can get on the same wavelength and just get real with our patients and say, this is the most likely thing you have, this is what it could do, this is the best way to treat it, how do you feel about that? And make it a conversation and understand where they're coming from, where their mind's at, can really go a long way. And the more I've been able to put that into practice ever since I've had that conversation, the more I realize how many patients was I letting go out the door where they weren't bought into the treatment plan. And I, as a doctor, should never pride myself in the amount of patients I was able to diagnose, but the amount of lives I was able to improve. And this mind shift was helpful to me. So hopefully any healthcare providers who watch this, it was also helpful to you. And yeah.